Hey guys, it's Danielle. Today I'm going to be doing the musculoskeletal and neurological video. I've got my nice patient here. We provided privacy, I washed my hands, and he is comfortable with doing this video. So I'm actually going to go a little bit out of order. I'm going to start with neurological. So the first thing that I'm going to do is I'm going to assess Nick's Babinski reflex. So Nick, what I'm going to have you do is lay down and bend your foot up to where we can see it in the camera. Okay. Bend your foot up a little bit. So what I'm going to do is we're going to go from heel to toe and see how Nick's toes react. Okay, so normal reflex. In a child, their toes are going to flail out, but Nick's, his come in. Completely normal for a 21-year-old male. Next, we're going to do some rapid movements. So I'm going to have you sit back up, actually. You're going to get lots of exercise in this video. And first, what I'm going to have you do is I'm going to have you take your fingers to thumbs, back and forth, just real quick, as fast as you can. Okay, perfect. Next, I'm going to have you take your hands and lay them on your hips, and then flip your palms over, pronation and supination. So I'm going to have you do that as fast as you can, also back and forth. Okay, so if someone had a neurological deficit, they would not be able to do these rapid movements effectively. The next test we're going to do is called finger to nose, and I'm going to have you close your eyes. I'm going to pick a finger, and I want for you to take it to your nose.
Okay.
And then back down. Okay. Okay. I'm also going to incorporate another test, and it's, I want you to keep your eyes closed, but I want for you to tell me what I'm doing to you. That sounds weird, but you'll know what I mean. So.
Pulling my finger back.
Okay, which finger is it?
Index finger on my left hand.
Okay.
Ring finger on my right hand.
Okay. So that's called the position sense test. What it is you're assessing to see if the patient needs to look at their fingers or their whatever you're moving, and if they have a good position sense of where it's at. So for instance, even if the patient is numb, such as in labor and delivery, our patients, when they get epidurals, they get numb from like the middle of their waist down. However, when I lift their leg, they can tell me, you're lifting my leg, I just don't know where it's at. And that's a normal reflex from getting the epidural. So the next test that we're going to do is I'm going to have you stand up, and we're going to focus down on your legs. I'm going to have you take one heel and run it down the opposite shin with your eyes open. Okay, and then now close your eyes and do the same thing. Okay, and do the same with your other heel. One time with your eyes open. Okay, and one with them closed. So I know you guys can't see Nick's eyes, but the first test was with his eyes open. You can sit back down. And the next was with his eyes closed. So now we're going to do a sensation check. So what I want for you to do is close your eyes, and I want for you to tell me what you're feeling where at on your body, okay? So this is the first article that I'm using. Tell me what you feel.
Soft on my face.
Okay, which side?
Left side.
Okay.
Pointy on my right side.
Okay.
Cold on my finger.
Okay.
Hot on my leg.
Okay.
Pointy on my toe.
Okay.
Soft or hot on my foot.
Okay, perfect. So what I used for those tests is I used a Q-tip, a facial hair removal brush, an ice pack, and a cup of coffee. All common things that I have at home and something that you commonly would have in the office. So the last part of the neurological exam is I'm going to elicit some DTRs. One of my favorite things to do in labor and delivery. We have a lot of MAG patients, so I get to do these tests all the time. So Nick, what I'm going to have you do is I'm going to have you relax your arms out. And I don't have a hammer. Normally I do, but sometimes when you don't, you can use your to elicit reflexes. So it worked compared to earlier. So normal reflex, I would call that a +2, potentially +3. That I would consider +2, which is normal reflexes. If Nick's hand was to come way up, that would be a +3 or +4, which is hyperreflexia. Next, I'm going to do the same for your knees. So I'm going to have you lay on your back. Yep, there you go. Okay. And then what I want for you to do is relax your legs, act like I'm not even here. Okay? Okay. And I know it's hard to see, but let me come on this side, actually. It's a little bit easier. If you watch Nick's toes, you'll actually kind of see them flex a little bit. And move it on this side. Act like I'm right here, completely flat and relaxed. And notice his leg kind of jumps a little bit. So Nick, I'm going to have you flip over. We're going to test your Achilles tendon real quick. And what I'll do, I'm just going to have you relax your foot, where I can kind of move his foot just a little bit. And then we're going to tap in the middle of the Achilles tendon. And notice that his foot pops a little bit out, which is normal. I can also test on both sides. And notice nothing happens, which is the normal reflex. We're going to do the same on this side. Just relax your foot for me. Okay. All right, perfect. So that concludes my neurological assessment. Next, we're going to move on to the musculoskeletal. And Nick, I'm going to have you sit up, actually. All the while of doing those assessments, I'm checking for anything abnormal, any swelling, lumps, tenderness, pain, anything like that. And Nick did not mention any of that to me. Maybe with the cup of coffee because I just poured it, but I didn't think that it was too terribly hot to use. So, also, while looking at his joints earlier, doing my reflex exams, I inspected them just by observation. Now I'm going to go through and I'm going to feel for any lumps, bumps, bruises, pain, anything causing Nick any discomfort. We're going to feel his elbow. We're going to look at his the head of the radius and ulna on both sides. What I'm doing is I'm just pressing a little bit, seeing if there's any pain or discomfort. Doing the same on his ankles, which is kind of hard. Also, I'm going to inspect the calcaneus, and we're going to feel the metatarsals of his feet, and I'm going to feel each of his joints and his toes. And I'm just pressing firmly enough to where if there was any pain, he would be able to tell me about it, but not enough to inflict pain purposely. Does any of that hurt?
Nope.
Okay. And I'm going to do the same on his hands. We're just going to feel for any tenderness in any of the joints. Does that hurt at all? Okay. And I like to use the pads of my thumbs and the insides of my fingers just because I can feel really well with those because I have little hands. Nick has an even distribution of hair throughout his body. There's no patches of missing hair or anything. He has a nice full head of hair and a nice full beard. He doesn't have any varicose veins. I didn't know if you could see it earlier, but there's no prominent veins in his legs, feet, knees, thighs, anything like that. So first I'm going to assess some pulses. We're going to feel his dorsalis pedis pulse first. So I'm going to have you bring your foot up a little bit and actually relax it down for me. What I'm doing is I'm feeling in between the first toe and second toe. You go, there's the joint right here, and you come a little ways back, and you usually palpate. And in his I can, so we're going to do it on your opposite foot also, in that exact same spot. It's kind of on top of the foot. It's kind of hard to see. And then I'm going to palpate the posterior tibial pulse also, which is where you come back here behind the Achilles tendon and palpate. Usually it's right here behind this prominence. And you can feel it really well. We're going to do the same on the other foot. Perfect. And that lets me know that he has good blood circulation to his feet. The other pulse that I'm going to feel is actually on the back of your leg. So I'm going to have you bend your leg, and I'm going to actually press kind of hard. And amazingly, I can actually feel his popliteal pulse. It's not abnormal to not be able to feel it, though, especially if you have a patient that's a little bit bigger, or if they are a little bit swollen in their knee joint, especially if they have potentially a cyst on the back of their leg in that fossa space, then it would be harder to feel the popliteal pulse. So next we're going to test some range of motion in his lower extremities. I'm going to have you lay on your belly to start. And we're going to have you do some extension and flexion. So what I'm going to have you do is bring this leg up towards your hiney, like lift your whole leg. And relax your leg, like relax your knee. Okay, now do like a leg lift. Bring it, no, like your whole leg. Like lift it back towards you. There you go, and down. Okay, and then I want for you to bring your leg towards me, like
Whole leg?
Yes, the whole leg, and then back in. So abduction and adduction is what we're assessing for there. What I'm going to have you do now is lay on this hip, so lay like towards the wall. Okay, and I'm going to bend your knee just slightly, and I'm going to push it forward. Okay, now does that cause any pain radiating up through your hip? Okay, so that's one way that we can test for sciatica nerve pain. Normally you hold it for 45 seconds, but I know that you're not having any pain today, so I'm not going to make you hold it for the full time. While we're at it, I'm going to have you roll all the way onto your back, and we're going to do some flexion and extension tests with your knee. So all the way up and back. Okay, and now I'm going to bring your knee out and back in. Okay, perfect. Now we're going to focus down here on your feet for a second. I'm going to have you flex your foot up and down, and then take it in a circle for me. Okay, and then do the exact same with this opposite leg. So bring it up and out, to the side and in, and then flex your foot in a circle. Okay, so Nick has full range of motion in both of his feet and his ankles. Nothing that I palpated earlier seemed abnormal. All of his range of motion in his hips seems to be appropriate. I can palpate his pulses, and nothing feels abnormal to me. The deep knee bend test earlier, which is what I did, assesses for sciatica nerve pain. And one final test that I'm going to have you do real quick is we're going to assess it's called a Romberg test. What it is it tests for balance. And while you're standing up, I'm also going to assess for scoliosis and kyphosis. Having known you for 3 years, I know that there's not a history of that, but for the purpose of my video, I'm going to have you do it anyway. So go ahead and stand up for me real quick. And I'm going to have you look at that wall. Okay, and then Nick, what I'm going to have you do is just bend over completely straight. And when I feel Nick's back all the way up along his vertebrae, they all feel completely straight. There's no bulging discs, and that he doesn't twist from side to side. Also, his hips are even, which lets me know that his spine is in alignment. So do me a favor and stand up. Okay. And I'm going to have you close your eyes. Just close your eyes and stand. Okay. So Nick's not swaying from side to side. I know it's hard to see from the side, but looking at him from the back, he's still completely straight. He's not moved at all. So that's what we call a negative Romberg test. What I have you do now, Nick, is lean from side to side. Yep, like that, and then back. And then I'm going to have you take your neck in just a big circle. Take it all the way down, back, and all the way around. Okay. I'm going to have you do it one more time. We're going to focus the camera in. So Nick has been having a little bit of neck pain in the last couple of days. So I noticed that on this left side, it's a little bit harder for him to bring his neck down, which is probably from his neck pain. We've been having him sleep on extra pillows. I'm using pain reliever and fever reducer. And for the lower extremities, everything seems to be completely perfect. When Nick gets up and down, I've been assessing his gait. I also watch him walk on a daily basis, and nothing seems to be abnormal with that. So, the last little bit that I'm going to do is we're going to assess the range of motion of his upper extremities, his shoulders, his arms, his hands, and I'm also going to palpate his radial and brachial pulses. So the radial pulse is going to be right here along the radial bone, just right behind the thumb. And you can palpate it. This is nice and strong. Nice and strong bilaterally. Also, whenever you take a blood pressure, you're palpating the brachioradial pulse. Perfect. So Nick, for range of motion, what I'm going to have you do is abduction and adduction. Abduction is taking your hands away. I'm also going to assess your wrists at the same time. There you go. Spread your fingers and take your wrists out. Now, when you bring them back, close your fingers together and bring your wrists together. So when you adduct, you're adding to the body. Abduction is taking away from the body. So do that again. Now spread your fingers. Bring them back together. Perfect. Next I'm going to have you do is you're going to bring your wrists up and down. Flexion and extension. Okay. Perfect. We're going to have you do the same with your arms. So bring your arms out. Pronation and supination. Okay, good as pronation, supination, whatever. And does that cause any pain in your shoulders? Okay. So one test that I'm going to have you do for your shoulders, I'm going to palpate right here along your clavicle. Come up here to the acromion process. And there should be a groove right in here, like the brachial groove. I'm going to have you take this arm and scratch your neck on this side. Okay, now take this arm and touch your opposite scapula around behind your back. Okay, now come around from the bottom side and try. Okay, now do the same with your other side. So what that's assessing for is Nick's range of motion of his shoulder muscles. If that caused him any pain, I would obviously not have him do it again, but he's not complaining of any pain on either side. So this completes my musculoskeletal and neurological assessments.